Why would I spend weekends and evenings away from my family to write this book? That's the question. It's a little more complicated than it seems. Let's see. First off, I'm a philosopher, and that's my first training. And I've always been interested in the intersection of philosophy and those disciplines that can do things with their hands. The philosopher I studied, Ludwig Wittgenstein, he became a nurse in World War II because he didn't think somebody should just be sitting writing books. Rather, he said people in times of trouble should be working with their hands. And I thought, yeah, I need to work with my hands as a philosopher. And I was teaching philosophy and very happy as a professional philosopher when both of my parents died at different times of chronic illness. And those were difficult, somewhat protracted deaths, full of ethical questions and spiritual crises. And so I wanted to figure out how I could work with my hands at that point of life for people who were struggling, families, patients. I took some time to figure out what to do with my life, and I decided nursing was the profession because I wanted to go into as a philosopher, because nurses wanted to know how to make it better for patients and families. And I stumbled upon the work of Annie Goodrich, a nurse who founded the Yale School of Nursing in 1923, and whose writings and speeches were collected as a volume called The Ethical and Social Significance of Nursing. What she said in there grabbed me, that nurses can make the world a better place for patients and families at the beginning of life, at the end of life, but also through the work that they do in everyday nursing practice. And that grabbed me. So in thinking about her and her work, I decided early on that I was going to try to bring her work from the 20s and 30s into the 1920s and 30s into the 2020s and 30s. So I started a project to write about the ethical and social significance of nursing as a philosopher and a nurse. And why this book? Because really that's what nursing is about. It's about making the world better for people now and in the future. And I thought it was worth spending evenings and weekends working on, in homage to Annie Goodrich, but also because I believe in the profession's power to do just what the title of the book says, to make the world better.
Hello, I'm Deborah Chun, Dean of the University of Connecticut School of Nursing. Nurses make the world a better place by always being there, wherever they are needed. No matter the task demanded, or how difficult or dangerous it may be, you can always count on a nurse to do what needs to be done.
Anybody who's been a nurse, you homeless people stumble into your emergency room, and really what they need is a warm bed and a sandwich. People come in to your cancer center after 40 years of very heavy smoking, and they've never ever had the resources or been given the opportunity to say, be in a smoking cessation program. You see the effects of a society that favors the rich and that favors the well-educated over the poor and the uneducated. And this has real health effects. And so I think, number one, nurses should be concerned about a good society because of its effects on health. But more than that, Annie Goodrich, in her collected writings and speeches called The Ethical and Social Significance of Nursing. She really founded Yale School of Nursing because she was a part of the progressive movement of the 1920s, that movement that wanted to make society better for the most vulnerable. And for her, it was women and children and the poor. So if you think that nursing can improve health, you improve health by improving the social status of the people whose health is going to be bad because they don't have access to education. They don't have access to health care or to a good job or to good food. All the things that we know are commonplace. We call now the social determinants of health. But even more than that, just this notion that all boats rise. And that's what really motivated Annie Goodrich. It was that if we improve the life of the lowest, of the poorest, of the most vulnerable, we improve the life of all. And in so doing, we improve their health, but we also improve their happiness, we improve their well-being, and all of that is the good stuff of nursing, not just health outcomes, but well-being outcomes, happiness quotients, all of the stuff that makes life good is the domain of nursing, she said. And so I think because as a profession, we're concerned about all that makes life good, warm beds, sandwiches, playtime for little kids that's safe, so forth and so on. The good society is our concern. The International Council of Nurses Code of Ethics and the American Nurses Association Code of Ethics begins with dignity, respect for human dignity. As I write in the book, I'm not sure I know exactly what dignity is. And philosophers can go back and forth on what it means. We can use dignity on two sides of an argument. Say the so-called right to die argument. It can be used that everybody needs a dignified death and so can choose their death, and it can be used on the other side of that argument that clinician-assisted death is not respecting human dignity. So dignity is a fuzzy concept, and I didn't know, what nurses meant by dignity, except to go back to sort of the origin of those codes of ethics. And they really were right after the Second World War with the Declaration, the United Nations Declaration on Human Rights. And that declaration also begins with dignity. So when you begin to look at what was going on around that time, it was really genocide and the Holocaust. So what are we talking about when we say that humans have dignity in the context of the Holocaust? We're saying there's something about the human form and the life that dwells in the human form that's to be respected at all cost. One way of knowing that the human form as the carrier of life is so important to us is that when a person has died, we treat the corpse with dignity, right? We cover it, we bury it, we cremate it, whatever is our tradition. Just today I saw, we're in the middle of the coronavirus pandemic, and just today I saw in a European newspaper that in Italy, they're carrying out corpses from northern Italian villages in dump trucks because their crematorium and cemeteries are overwhelmed. So they're taking them out to bury them elsewhere or to cremate them elsewhere. And that just seems undignified to us. Of course, it's what has to happen in a pandemic, but it's not how we treat the human body in which once dwelt human life. And so this notion that the body is the sort of house of life itself. And what do we all share as the human community? We share that sort of breath of life. We nurses know this all so well. We count respirations and inspiration, right? We know what these words mean, and in their Latin, they mean breath. They really mean the thing of life. And so rather than talk about dignity as a fuzzy concept, I want to talk about that thing that we all share across all of the human community, regardless of our traditions, regardless of our language, even regardless of how we think of dignity. So either side of an argument, we all have one thing in common, and that is we all have the same sort of breath in us. And that's what I wanted to focus us on. And as nurses, focus us on that notion of the human community as the collection of people, animals, whatever, that have human breath. Yeah, so I just talked about the United Nations Declaration of Human Rights, and certainly human rights are important. But in the book, I choose to focus on obligations because of a philosophical notion that obligations precede rights. The French philosopher Simone Weil, she died in the war because she was a French Jew, and she escaped to Britain during World War II. And when she was in Britain, she was eating the rations that people in France would have to eat. And essentially, she starved to death on those rations. But meanwhile, she did a lot of writing. And The Need for Roots is one of her books that really has touched me in my life. And in there, she says, while she's basically starving, she writes that obligations precede rights, that they're the positive side, and rights are the sort of negative. If those of you who can remember old-fashioned film, they're the flip side of obligations. You only know that you have rights when you're not enfranchised with them. So you think of suffrage, the right to vote. Well, that was for people who didn't have it. But what was going on when women and people of color didn't have the right to vote? Well, it was in Simone Weil's argument that people weren't fulfilling their obligations toward the human community. And that was what was going on in World War II, in the genocide, the Holocaust, that people were actually abrogating their obligations to humanity. And so I wanted to focus on not the negative side of it, what are our rights, in a kind of way of establishing a claim, but rather what are our obligations so that people don't have to establish that claim to rights. What are the obligations that we as a profession have to the human community so they are enfranchised with their rights? You could choose any sort of obligations that mirror rights, but these seemed to be the ones that were relevant in 2020, relevant in our times. Equality. We know so much is going on because of inequalities. And again, as a person of my times, we're talking in the middle of the coronavirus pandemic, and it's been established that people who are poor, who are in hourly wage jobs, who have no health insurance, who have no child care, etc., they're going to be hit so much harder by by this pandemic and its economic as well as health effects. And so if you think about equality right now, um, um, to focus on the inequalities or the health inequities or the disparities, to me is just the wrong way around. Let's focus on human equality and the obligations or the demands of human equality. And so that's why equality was so important to me. You know, I get health equity is so important, and people talk about health equity as level of the playing field, or the most common image is of people standing at a fence and a tall person can see over the fence, but a medium-sized person can barely see over with their eyes, and a short person can't see over at all. So you get boxes to level up all of their heights so they can see over the fence equally. That's what you have to do to fulfill your obligation to human equality. But in that sense, equality comes first. And I just wanted to recognize in that human equality.
This is Dr. Norman Carl-Swart, a lecturer at the University of Botswana. I'm a nurse practitioner and a family nurse practitioner. To me, health equity is where everybody has an equal opportunity or equal chance to attain the best level of health possible. I think nurses promote health equity in their day-to-day lives by ensuring that everyone, whether rich or poor, with or without insurance, receives the same kind of health care, which is of high quality. And I think the nursing profession can promote health equity by advocating for universal health care to everyone, not just in America, but also in poor countries or developing countries such as Botswana, in other countries, sub-Saharan Africa, and in Asia. Thank you.
So assistance is important because anyone who went to Yale School of Nursing and was taught by Linda Honan knows Virginia Henderson's definition of nursing. And nursing is to do for the patient what the patient would do for him or herself, unassisted, if he or she had the will, knowledge, or power to restore the patient to health or to lead to a peaceful death. And that of course, it's been drilled into me, but that concept of nursing really struck me because it gave the person this sense of ownership over their lives. Now, I don't like the word autonomy, and we can come back to that at a different point. But it's that when you assist somebody, you help them achieve their goals. You help them achieve the life that they want to lead, and that's that little bit, helping them achieve the life that they value, is key, because I take the definition of the good society from the Nobel economist and philosopher Amartya Sen, who says that really the good society, or as my take on his work, is that the good society is one in which a person is free to be and to do that of which they're capable. Another way he puts it is that a person is free to be and to do that of which they're capable to bring about the life they value. So how can you lead a life that you value, that you have reason to value? And when you're sick, or when you're potentially sick, or when you're dying, you have ideas about the kind of life that you value, even as you're dying. oncology and palliative care nurse. I know that. I've seen it over and over again. So how can I help a person? How can I assist them to lead the life that they value, to be and to do what they're capable of in that moment, and hopefully in future moments? And so this notion of assisting in Virginia Henderson's definition of nursing, and this notion of the good society as leading the life that you're able to lead, or the life that you have reason to value to lead, they came together for me. And that if nurses can assist people in those activities that they need to do to get well or to have a peaceful death, then we really are bringing about the good society in this notion of assisting. The World Health Assembly in the 80s finally realized that thermonuclear war was, at that time, the biggest threat to the human community. It may now be climate change, but it's hard to pick and choose between the two, because it really could be one fell swoop. Not that long ago, almost another Cold War between the United States and Iran, and we're all thinking, oh, could this be a nuclear war, and its devastation to the human community, to human health, for millennia to come, with fallout, etc. And I also was very taken with Elaine Scarry, professor at Harvard, on her book on thermonuclear war, and really began to see that war is the opposite of nursing. Nursing heals. Nursing binds wounds. Nursing, brings peace to the dying. Well, that's quite the opposite of war. And so I really had to stop and think that we, as nurses and as a profession, we can talk about healing, we can talk about caring, we can talk about all this holistic stuff that is the stuff, the soup of our profession. But unless we talk about the biggest threat to that soup, war, then I don't think we're doing our jobs. And I didn't want to talk about war. I wanted to talk about what we could do, the positive side of it, the obligation, and that is to promote peace. So that's why that one ranked up there for me as including in my 6. Safety. I'm back to Annie Goodrich, the status of women and children. Sheila Tlou, T-L-O-U, she's a very important nurse, perhaps the highest ranking nurse in the world right now, former Minister of Health of the Republic of Botswana, and a UN AIDS Director for Southern and East Africa, but also a High Commissioner for the Status of Women and Children at the UN. And when you start digging into the work that they've done on that commission, women and children really are, around the world, the most vulnerable. And I do think that at the heart of the profession is to keep the vulnerable safe and to lessen their vulnerability. Now, I think to be human is to be vulnerable. Look, we're all held up in our houses during this coronavirus. We're sequestered because we're vulnerable to it. We have no immunity, and we don't know who it's going to afflict in ways that could mean their death. So we're all staying inside, and we're limiting our contact with other people because as humans, we're vulnerable. But there are degrees of vulnerability. And I think as nurses, as concerned about the human community, we go first to the most vulnerable, and then we assist them. We bring them to safety. And so that just seemed, again, to be the heart of where the social significance of nursing is right now, with women and children still being the most vulnerable populations around the world.
Hello, I'm Ann Kurth, Dean of the Yale School of Nursing, where our mission is better health for all people. To me, planetary health is about balance. It means drawing closer to a state where humans live within the bounds of those underlying systems that support life for all species. Instead, as we know, today we are exceeding those boundaries, and the resultant climate damage, oceans that are rising and acidifying, extreme weather, strain on food production and water scarcity are more evident daily. The push by humans into other species' ecological niches also is leading to emerging and re-emerging pathogens, as we've seen with the coronavirus, SARS-CoV-2, and the COVID-19 disease pandemic. This too is planetary health. Planetary health is viewed as a new area of science and practice, but it's actually one that draws from foundational precepts of environmental health, ones that Florence Nightingale and other nursing scientists understood, as have many indigenous cultures around the world, from whom we can all learn and relearn important precepts around managing the health of humans more in harmony with natural systems. I see that nurses promote planetary health in their daily work by virtue of the fact that we have a call to advocacy embedded in our very definition of nursing. Planetary health stresses are being felt first and hardest by vulnerable populations, already facing inequity, poverty, and discrimination. So planetary health becomes an ethical as well as a clinical and population health issue. I know, however, that our profession of nursing can promote planetary health in several very important ways. One is to ensure that our health systems become more green and that we reduce our environmental footprint. Globally, the healthcare sector accounts for up to 10% of all greenhouse gas emissions. So we need to get our literal house in order. Doing this through more biophilic building design, renewable energy, less waste, more local food production, etc., will in fact have great health co-benefits for patients and community members. We also need to prepare our health systems to adapt for the planetary health stresses that are occurring and that will have increasing impact in number and stress in the next decade. Nurses know how to plan for crises. We're very pragmatic. I can remember during Hurricane Sandy when it was the NICU nurses who were ambu bagging the babies down dark stairwells to send them out to higher and safer ground throughout the city. Climate change is a kind of slow-moving crisis, but it is in fact right in front of us, and nurses need to lead to ensure that their health systems understand vulnerable populations in their catchment area, are able to deliver crucial services during crises, and bounce forward afterwards to ensure continued population health. Nurses can do this, and we must.
The earth, yes. Well, as I already alluded to, perhaps climate change ranks next to or maybe equal or slightly above thermonuclear war right now in its potential devastating effects on the human community. But let me stop here and say that I struggled with this a lot, how to talk about this, because I do think Earth itself has a moral claim. Clearly, what we've learned through environmental science is that what we do to Earth affects Earth in a way that the Earth can't take care of itself. So it can't repair itself very easily from an ozone, a break in the ozone layer, say, or the melting ice caps. What we do to Earth is injurious of Earth. And so this afflicting injury on it in a way that's quite clear and palpable means to me that Earth has its own moral claim. And as nurses, we are to heal. We're not to inflict injury. And so I thought we needed to step back and say, this isn't just about human health. this is also about Earth's health. And yes, unless we take care of Earth's health, human health will be over, right? We're dependent on Earth for our health. But Earth in itself, even without us, has this claim and can say, if we can anthropomorphize Earth, you've harmed me. And so what do we do now, knowing that we have harmed Earth? How do we stop the harm, and how do we repair it? How do we heal it? So I almost veer on this side of anthropomorphizing Earth, because I want us to see the abject injury that we've done to it.
I'm Professor Suzanne Chambers, and I'm the Dean of Health at University Technology Sydney. Respect is valuing, admiring, appreciating the unique qualities of each individual. As a nurse, we show respect by seeing that in each of our patients, being non-judgmental, accepting and finding those qualities in that person and making it clear to our patients and their families that we respect them as individuals. And we do this every day. Thank you.
Go back to the notion of how we treat the human dead. We treat them with great respect. And go back to the notion that the codes of ethics for nurses around the world begin with the notion of respect for human dignity. And I needed to go back there. So what does it mean to respect the human community and all these obligations that I've talked about? And what is the obligation of respect itself? And I do a little Latin wordplay there, etymology, and respect is to look back upon. I tell the story in the book of a patient who was dying, in whom I thought I could see myself, like I was looking back upon myself. I had a professor once who was at Yale, at the Divinity School, and if you know Yale at all, the Divinity School is up the hill, and you have to walk down the hill to get to the university. And he was walking up the hill toward the Divinity School, and somebody was walking down the hill to the main campus of the university. And he said when he passed that person, he looked back and saw himself in that other person. And that's respect. That's looking back upon others and seeing this sort of common thing that you share. And so I think in all of these obligations, we share a common thing, and that thing is life, breath. I think Earth shares it with us because we breathe Earth's breath. And so I basically ask us to look back upon the people that, we assist, the people we bring safety to, the earth, the people we try to save from the ravages of war, and for whom we promote peace, and all the discussions of health equity. That actually what we're doing is saying we look back upon the other and we see the common breath that we breathe. We see the common life. We see the common humanity, and that is respect. What's global nursing? I think global nursing today is taking all of these obligations and living them where we are, and realizing there are nurses all over the globe who do the same thing that we do everywhere. There are nurses that I've been all over the world and seen nurses who do the same things that we do. Of course, we can engage in capacity building, and there are nurses in other parts of the world who can come and build our capacity, lest we in the United States think we are at the top. For instance, I learned how to treat patients with HIV from a nurse prescriber in Botswana. But global nursing now to me in broad strokes is realizing that nurses everywhere are doing the good stuff that nurses do. And that if we can focus on these obligations to society, and that 20 million plus nurses are doing it, we can see the power of these nurses around the globe making the world a better place. And that's global nursing. It's not going to aid the poor nurses here or there. But in the context of the coronavirus, it's something a little deeper. It's that the world is now smaller because of travel, because of global climate change. Diseases that could once only live, say, in tropical areas are now living as far north as Connecticut, Zika, for example. That there are no longer the boundaries that we once thought.
I am Dr. Tracy Kelly, Assistant Professor of Nursing at the University of Virginia. Global nursing is the compassion and commitment all nurses share, but it embraces partnership with nurses transcending borders. It provides expert care, mindful of limited resources, but undaunted by the constraints, and yet aware of the health strain of migrant populations and climate change and new diseases. Global nursing is a sharing of best practice and educational techniques and research findings. For example, very early in my own career, when I worked in Cambodia, I was taught by a Filipino nurse how best to assist in the delivery of a baby. I hadn't been taught that in my nursing program, but the Filipino nurses were midwives as well, and so I learned from them. Years later, I participated in the American Academy of Pediatrics Helping Babies Breathe program, teaching midwives in Mauritania who would spread their new knowledge to nurses all over their country. I've been fortunate to partner with the nursing faculty in Rwanda, sharing ideas on the use of simulation to teach students practices of fluid and electrolytes and resuscitation. Uganda has become the recognized leader in palliative care, both in advocacy and research. For almost 20 years, specially trained nurses have widened their authority and legally prescribed opioids to dying patients, recognizing pain control as a responsibility and duty in nursing. We learned from the Nigerian nurses during the Ebola epidemic how to use mass public service announcements to reach the most remote areas to limit the spread of the infection. Today, the Singapore nurses, having learned from previous pandemics, are teaching us how to rapidly and effectively distribute needed PPE for COVID-19 protection. But global nursing expands beyond patient care to a role in leadership. The International Council of Nurses advances the nursing profession through policy and advocacy. The Nursing Now campaign is a global endeavor in collaboration with the World Health Organization, the International Council of Nurses, to improve health by raising the profile and the status of nursing worldwide. So, what do I think global nursing is? I think it's embracing the common bond among nurses, approaching professionally and without judgment cultural and practice differences across borders. It's a commitment to our profession to learn from and to advocate for nursing in all countries, under any conditions, with the understanding that every human, regardless of country of origin or resources within their healthcare system, is entitled to the very best care nurses can provide.
Annie Goodrich founded the Yale School of Nursing in 1923, just 5 years after the 1918 flu pandemic that devastated much of the world. And here we are again in a pandemic, walking its way across the globe, striking for dominance, and global nursing in that context is to realize that the nation state is really, really obsolete. That when it comes to health, that the borders that we set up are so artificial that disease and disorder just march across the globe in a matter of months. And so nurses everywhere are about the public's health everywhere. And I think we have to come together in this notion that the public is everywhere and the public's health is everywhere, and that nursing has to be everywhere in equal measure and status to any other profession that's about making the world a safer, better, healthier, more livable place.